Welcome to today's lecture from Chapter 14, Risk of Infection and Communicable Disease. In our discussion today, we will cover infectious versus communicable disease, outbreak investigation of person, place, and time, public health surveillance, foodborne and waterborne illnesses, and sexually transmitted disease. Question: is the following statement true or false? A carrier is a person or animal who harbors an infectious organism and transmits the organism to others while having no symptoms of the disease. Are you prepared to be a carrier? Let's go to the next slide for the answer. The answer here is true, and the rationale. A carrier is a person or an animal who harbors an infectious organism and transmits that organism to others while having no symptoms of the disease. For example, carriers of the hepatitis B virus who are asymptomatic can transmit the virus through percutaneous inoculation, exposure to mucous membranes, or through sexual contact. Another example might be a deer who harbors the deer tick. Again, this is a person or an animal who harbors the infectious organism but has no symptoms of the disease. Infectious disease. An infectious disease is one that is caused by the growth of a pathogenic microorganism. It is defined as the presence and replication of an infectious agent in the tissue of a host, with manifestation of signs and symptoms. Pathogenicity. The progression of infectious disease depends upon its pathogenicity, or the ability of the infectious agent to produce disease in a susceptible host. Pathogenicity is dependent upon the infectivity of the agent and its ability to invade and destroy the bodies of cells. Pathogenicity also depends on the ability of the agent to produce toxins. Lastly, pathogenicity depends on virulence, which is the severity of infectious disease that results from exposure to the agent. Communicable disease. A communicable disease is one that is spread from one person to another or from animal to a person. For disease to be considered communicable or contagious, there must be a portal of exit from the infected person or animal, a means of transmission, and a portal of entry to a new susceptible host. It can be spread through airborne viruses or bacteria and through contaminated blood or body fluid. Epidemiology and the chain of infection. The chain of infection is based on the epidemiologic triangle, which has been discussed previously. The process in the chain of infection is more involved. Therefore, other elements have been added. These elements include the portal of exit from the host, the environmental reservoirs, a mode of transmission, a portal of entry to a new host. For disease to be communicable or contagious, there must be a portal of exit from the infected person and a portal of entry to the new susceptible host. It is important to note that just the presence of an infectious agent is not sufficient to produce an infectious disease. I repeat, it is important to know that just the presence of an infectious agent is not sufficient to produce an infectious disease. There are several key factors to determine whether a person is at risk of an infection or an infectious disease. These include age, sex, race, physical, and emotional health. Please go to your Harkness and DeMarco text on page 256 to review this information, as you will see it again. You will see on this slide all of the elements of the chain of infection. Again, the infectious agent, a reservoir, which could be the environment, a portal of exit, a mode of transmission, a portal of entry, and a susceptible host. The chain of infection continued. One thing that I mentioned in our previous slide is that you need an environmental reservoir. An environmental reservoir can be humans, animals, plants, insects, water, and soil. Interestingly enough, changes in the environment can influence the transmission of diseases that are waterborne, airborne, and vector-borne. An example of a change in environment is during Hurricane Katrina. It had major effects on the environment, which caused disease transmission. And at the time that this natural disaster occurred, many people were seen in local hospitals or makeshift care centers and were being treated for airborne, waterborne, and vector-borne diseases. Continuing on with our discussion on the chain of infection. Transmission from the reservoir to the host can occur through airborne, direct and indirect contact, and droplet transmission. Airborne transmission occurs when microorganisms are carried in the air through small particles. For example, TB is released by coughing, sneezing, or speaking. Direct contact transmission of disease occurs when there is body surface to body surface contact with a person or animal. Indirect contact involves the spread of the disease through a vehicle of transmission such as a contaminated needle, toys, or soiled clothing. MRSA, or methicillin-resistant Staph aureus, can be spread through indirect contact. For example, through a nurse's contaminated uniform that has not been washed or washed properly. MRSA can live up to a week on clothing after contact. This is just one example of ways of indirect contact and transmission of disease. Lastly, droplet transmission can be direct or indirect transmission of the disease, usually because it is spread by coughing or sneezing. It can be spread up to 3 feet and deposited on the mouth or nasal mucosa of another person. One example is influenza. Moving on to some key terms in infectious disease. Colonization is the presence and multiplication of an infectious organism without invading or causing damage to the tissue. Our next key term is incubation period. This is the time period between the initial contact with the infectious agent and the appearance of the first signs or symptoms of the disease. Question: is the following statement true or false? An infectious disease is not contagious or communicable. If you think about it, the answer is false. An infectious disease may or may not be contagious or communicable. An example would be Lyme's disease. It is spread by an animal or insect, but it is not contagious and cannot be spread from one person to another. Now we'll talk about the steps required in an outbreak investigation. When an outbreak of an infectious disease occurs, a comparison of the current incidence of cases with a baseline or endemic status is essential. The first occurrence of an infectious disease not previously seen in that area requires prompt reporting and investigation. Box 14.3 of your text outlines the steps necessary in an outbreak investigation. The steps are as follows. Establish and verify a diagnosis of reported cases and identify the agent. Search for additional cases, collecting critical data and specimens. Next, characterize cases by person, place, and time. Then the nurse will formulate and test a tentative hypothesis regarding possible causative factors. Now the nurse will implement control measures, to control the outbreak and evaluate the efficacy of those control measures. And lastly, the nurse will want to communicate the findings through a written report so it becomes public information. Types of outbreaks. There are 3 different types: endemic, epidemic, and pandemic. An epidemic is the constant or usual prevalence of a specific disease or infectious agent within a population or geographic area. An endemic is a characteristic of a particular population, environment, or region. One example of an endemic is chickenpox. Chickenpox occurs at a predictable rate among young schoolchildren in the U.S. The disease is present in a community at all times, but in relatively low frequency. An epidemic is a significant increase in the number of new cases of a disease than past experience would have predicted for that place, time, or population. It's an increase in the incidence beyond that which is expected. An example of an epidemic is the SARS epidemic, which took the lives of nearly 8,000 people worldwide. Lastly, a pandemic is a global outbreak of the disease. An influenza pandemic occurs when a new subtype of a virus arises. Everyone is at risk because humans have little or no immunity to it. Infectious disease and healthcare-associated infections. Healthcare-associated infections are also known as nosocomial infections. It is estimated that 1 in 20 hospitalized patients develop a hospital-related infection that ultimately costs the healthcare system billions of dollars every year. Nurses play an important role in the prevention of healthcare-associated infections and represent the first line of defense for such adverse outcomes. Some examples of healthcare-associated infections include UTIs, which are also present in nursing home patients, surgical site infections, and bloodstream infections related to improper access of central line catheters. The best method of prevention is good hand hygiene, either using foam when indicated or soap and water. Public health surveillance. How do we monitor disease and who is responsible? At the federal level, the U.S. Department of Health and Human Services is involved in protecting the nation's health. The CDC is a U.S. Department of Health and Human Services agency that protects health by developing guidelines that promote health and quality of life. The Centers for Disease Control is a form of surveillance. Surveillance is defined as a continual dynamic method for gathering data about the health of the general public for the purpose of primary prevention of illness. Think of this as a monitoring process for disease. Per the CDC, notifiable disease surveillance begins at the local and state level, where health departments notify the CDC about the occurrence of certain conditions. And just note that at the federal level, that reporting is not always mandatory, but it is definitely suggested for those reasons stated. Surveillance may include the reporting of specific communicable diseases. There are 3 main types of communicable disease: foodborne, waterborne, and sexually transmitted disease. The next few slides will provide more information about each area. Foodborne infectious disease. Foodborne diseases include the following: noroviruses, Campylobacter enteritis, Listeria monocytogenesis, non-typhoid Salmonella, and Listeria coli. The norovirus is referred to as the stomach flu. It is spread by the fecal-oral route and is the most common cause of infectious gastroenteritis in all ages. Symptoms may include vomiting, diarrhea, and dehydration. Campylobacter enteritis is the most common cause of bacterial foodborne illness. It is related to the consumption of poultry, which is the most common source, and it is often implicated in travelers' diarrhea. Symptoms may include diarrhea and nausea and vomiting. Listeria is linked to smoked seafood, soft cheeses, or deli meat. It can be fatal in pregnant women, immunocompromised patients, and in the elderly. Symptoms may include diarrhea. Salmonella is a bacterial disease transmitted by contaminated food, water, contact with infected animals, or reptiles. It can also be spread through the direct or indirect contact with live poultry. Symptoms may include diarrhea, fever, abdominal cramps occurring within 12 to 72 hours after exposure. Lastly, E. coli is typically caused by the ingestion of undercooked beef or fresh produce that has been contaminated. Some of you may recall a spinach recall that occurred a few years back. Symptoms of E. coli may include blood in the stool, diarrhea, and vomiting. Severe cases may lead to renal failure. Please take the time to read over this information in your textbook, as you may see it again in the future. Waterborne diseases. Generally, a lack of sanitation is the main contributor to unsafe drinking water and the development of waterborne disease. The CDC and the EPA set standards to protect drinking water and its sources against contaminants. Waterborne illness can be attributed to 5 pathogens as listed above. Legionnaire's disease is a type of waterborne illness that can be associated with drinking water. You may recall hearing about the cases of Legionella that were linked to the water crisis in Flint, Michigan. Disease such as Pseudomonas and E. coli are often linked to recreational water, such as public pools or hotel pools and spas. Pictured above is an image of Cryptosporidium. Reference the link provided for an article on Cryptosporidium found recently in swimming pools in the Ohio area. That information is just for extra knowledge and will not be tested on. That is provided in that web link. Sexually transmitted diseases. Sexually transmitted diseases know no socioeconomic or racial boundaries. It is estimated that the rate of infection for STDs may be twice that of the reported rate. If it's going undiagnosed and untreated, then it is probably not reported. Most STDs have no symptoms, such as chlamydia. Therefore, they're going untreated and unreported. It is important to understand that bacterial infections can be treated with antibiotics. However, viral STDs cannot. Gonorrhea and chlamydia infections usually occur together, causing an emerging antibiotic resistance concern. Syphilis is known as the Great Intimidator. It is defined by 2 stages. In the first stage, sores appear where the syphilis entered the body. The sores are round, firm, and painless. In the second phase, if left untreated, a non-itchy rash will appear on the soles of the feet. Viral infections such as HIV are spread through unprotected sex with an infected person or sharing of infected needles. HIV is not spread through blood transfusions in the United States because of screening and processing of blood. The hepatitis B virus may be transmitted through body piercing or tattooing and becomes an STD when it is transmitted through mucosal contact with infected blood or bodily fluids. At risk include those who are not in a long-term monogamous relationship. Please read over this information as in your textbook. Sexually transmitted diseases. Who is at risk? Any person is in a high-risk group for an STD if they have multiple sex partners, do not use a condom during sex, have other STDs, and have a partner with an STD. Prevention and control of specific infectious diseases. Prevention is key in health promotion, and community health nurses play an important role in prevention through education efforts. Preventative measures reduce the risk of exposure to communicable and infectious disease. Preventative efforts can be primary, secondary, and tertiary. Primary preventative measures include education on STDs, foodborne and waterborne illnesses. Vaccinations are another mode of primary prevention in the deterrence of STDs. Secondary prevention may include prophylactic treatment after an exposure to an infectious disease has occurred. An example of tertiary prevention is treating opportunistic infections among those infected with HIV. Preventative measures for foodborne illnesses include proper food storage and handling, hand washing washing hands and utensils that have come in contact with raw meat, poultry, and eggs. Steps to prevent waterborne illness include knowing where your water comes from and avoiding swallowing water from lakes, pools, rivers, and spas that may be contaminated. Do not swim if you are ill with diarrhea, and wash hands after using the restroom. Educating the community about prevention and control of infectious disease will assist in the health promotion of the population. That concludes our lecture for today on infectious disease. If you have any questions, please do not hesitate to see me. Thank you and have a great day.